Smallpox is an communicable disease because this picture shows that skin rash virus, variola virus, cause smallpox. A detail going on. Introduction. Smallpox is a contagious and potentially deadly disease caused by the variola virus. It was one of the most devastating diseases known to humanity, with an extraordinarily high mortality rate before it's eradicated. Through a global vaccination campaign led by the World Health Organization, smallpox was declared eradicated in 1980, making it first disease to be completely wiped out. Definition: smallpox is an acute viral infection caused by the variola virus. It is characterized by fever, body ache, and the development of a distinctive progressive skin rash. The virus can spread via respiratory droplets, direct contact with infected bodily fluids, or contaminated objects. Types: smallpox manifest in different forms varying in severity. Born variola major, the more severe form with a fatality rate of 30% or higher. It includes 4 subtypes. A. Ordinary smallpox, the most common form, making up about 90% of cases. B. Modified smallpox, milder cases in previously vaccinated individuals. C. Flat smallpox, a rare but severe variant with higher mortality rates characterized by a flat soft rash. D. Hemorrhagic smallpox, extremely rare but severe, involving extensive bleeding into the skin, mucous membranes, and gastrointestinal tract. It usually fatal. Causes: smallpox is caused by the variola virus, a member of the orthopox virus family. The virus enters the body through the respiratory tract and spreads through the lymphatic system, eventually causing viremia, the presence of virus in the bloodstream, leading to the development of a rash. Risk factors: before eradication, anyone exposed to the virus was at risk of infection, but the following factors increased susceptibility. 1. Lack of vaccination. People without a smallpox vaccination were at the highest risk. 2. Close contact with infected individuals living in close quarters with smallpox patients. 3. Healthcare workers, those involved in caring for smallpox patients facing increased risk due to direct exposure. 4. Immunocompromised individuals, those with weakened immune systems were more vulnerable to severe forms. Complications. Smallpox can cause severe complications, especially in the more aggressive forms. 1. Scarring. Extensive deep scars, especially on the face, are a hallmark complication. 2. Blindness. In some cases, smallpox leads to corneal ulceration resulting in blindness. 3. Arthritis and bone infection. Secondary infection can lead to long-term joint problems. 4. Death. In the more severe form, especially hemorrhagic and flat type, smallpox is fatal. Pathophysiology. Once the variola virus enters the body, it replicates in the respiratory mucosa and lymph nodes, eventually entering the bloodstream. The virus then infects internal organs such as the spleen, bone marrow, and liver. A second wave of viremia leads to widespread infection, including the skin, where the characteristic pustula rash develops. The immune response, triggered by the virus, eventually clears it from the body. But in severe cases, the virus overwhelms the immune system, leading to complications or death. Pathophysiology. Smallpox pathophysiology step-by-step process. 1. Viral entry, transmission, target site. 2. Primary replication, initial multiplication, incubation phase. 3. Viral spread, primary viremia, lymphatic spread, primary viremia. 4. Secondary replication in organs, viral replication in organs, cell damage. 5. Secondary viremia, massive viral release, immunoactivation. 6. Skin infection and rash development, viral tropism for skin, early rash, muscles and papules, pustula stage. 7. Viral shading and contiguous space, contiguous period, pustula breakdown. 8. Scapping and healing, pustula drying, virus clearance. 9. Immunoresponse, innate and adaptive immunity. 10. Complications in severe cases. The step-by-step pathophysiological process explains how smallpox progresses from initial infection to disease manifestation and resolution. Signs and symptoms. Signs and symptoms of smallpox progress through stages. First stage, incubation period 7 to 17 days. No symptoms occur during this period. 2. Initial symptoms: high fever, malaise, severe headache, back pain, and vomiting. This stage lasts 2 to 4 days. 3. Early rash. Red spotty rash appears on the face, hands, and forearms before spreading into tract. The rash turns into raised bumps and then fluid filled pustules. 4. Pustular rash. The pustulas become larger and firmer. The scab over other about 8 to 9 days, leaving deep pitted scars. 5. Scabbing and recovery. Over the next 1 to 2 weeks, the pustules scab over and fall off, leaving scars. Diagnosis. Diagnosis of smallpox was based on clinical presentation, but in the modern era, laboratory tests would be used. 1. Polymerase chain reaction (PCR), the most accurate test detecting viral DNA in samples. 2. Electron microscope used to visualize the virus. 3. Serology, testing for antibodies to the variola virus. 4. Viral culture, growing the virus in the laboratory setting. Nursing diagnosis. Nursing diagnosis for smallpox would focus on addressing symptoms and complications. Common diagnoses include: 1. Hyperthermia related to the febrile phase infection. 2. Impaired skin integrity related to pustular rashes and scarring. 3. Acute pain related to skin lesions and systemic symptoms. 4. Risk for infection due to skin lesions and weakened immune system. 5. Fear and anxiety related to potentially severe course of disease. Management. Management of smallpox focuses on symptom relief, preventing complications, and patient isolation to prevent the spread. Key interventions include: 1. Fever management using antibiotics and cool compresses. To skin care, maintaining clean and dry skin to prevent secondary infections. 3. Pain management, administering analgesics to manage discomfort from the rash. For isolation precaution, strict quarantine of the infected patient. 5. Psychosocial support, providing emotional and psychological support to reduce fever and anxiety. Treatment. There is no specific antiviral treatment for smallpox, but supportive care and symptom management are critical. Potential treatments include 1. Antivirals, tecovirimat and cidofovir have shown some efficacy against orthopox viruses. 2. Vaccination post-exposure. The smallpox vaccine can be administered up to 4 days after exposure to prevent or reduce the severity of the disease. 3. Supportive care, hydration, managing secondary infections and respiratory support if necessary. Psychosocial medicine. The psychological impact of smallpox, particularly in severe cases, is profound. Survivors often experience disfigurement from scarring, leading to social stigma, low self-esteem and long-term mental health challenges. Also address these psychosocial aspects, providing 1. Counseling for body image issues and emotional trauma, 2. Support groups for sharing experiences and coping strategies with others who have facing similar challenges. Prevention. The most effective method of preventing smallpox is vaccination. Key preventive measures include 1. Routine vaccination before eradication. Widespread vaccination campaigns were the primary method of control. 2. Post-exposure vaccination given within a few days of exposure. This can prevent or mitigate the disease. 3. Quarantine and isolation in the event of an outbreak. Rapid isolation of cases and monitoring of contacts is essential. In conclusion, smallpox was once a global public health threat, but the concerned efforts of scientists, healthcare professionals, and government worldwide successfully eradicated it. While the disease no longer poses an active threat, the variola virus remains stored in secure labs for research purpose. Ongoing vigilance and preparedness are necessary to prevent potential outbreaks. The legacy of smallpox underscores the critical importance of vaccines in controlling and eradicating deadly infectious disease. Thank you. Have a nice day.